afternoon. Thanks. I know I'm short, so I'll stand on my tippy toes for a little bit. Thank you all for coming. Hopefully this afternoon, what we'll do is we'll start off with some introductions by the candidates, and then for about 45 minutes, I have some questions that I can pose to them, but I'm really hoping that we allow about a half hour for you all in the audience to ask questions for Peggy and Shannon. So be thinking of those questions. So with that, I will let the candidates introduce themselves.
How much time do we have to introduce ourselves? 5 minutes? Okay. My name is Shannon Savick, and I am a senior citizen. You can probably tell that by looking at me. I'm running for re-election. I served a 2-year term. I have a story to tell you. My husband was in long-term care for about 1.5 years. He died in February. So I've had experience with having a spouse in long-term care. And I think there are some things that we need, some laws that we need to change, and I'll be talking about them a little later. We need to find a way to pay for long-term care. I was just reading in the Wall Street Journal that people that are 55 years old, 60% of them have saved less than $100,000 for their retirement, and 24% of them have saved less than $1,000. So if we're thinking about people paying for their own long-term care, it's not going to happen because they can't. It's too late almost if you're 55 years old to start saving for that. And most of these people cannot afford long-term care insurance. In 2030, 1 out of 5 of us will be senior citizens. And if we don't do something about paying for long-term care now, the state is going to go broke paying for long-term care. So basically with that, I'll turn this over to Peggy.
I don't strangle you.
Now that would be one way to get rid of the competition.
You missed that. I said I'll move the cord so I don't strangle her, and she said that'd be one way to get rid of the competition. So no, I won't do that to you, Shannon. I'll stand up so I can see you all over there too. I'm Peggy Bennett, and I've never run for office. Matter of fact, if you would have told me a year ago I'd be standing here in a forum on long-term care because I'm running for office, I would have told you were crazy. I never thought I would be doing such a thing, but I'm excited about this. I'm a teacher. I've been teaching for 33 years in Albert Lea, mostly first grade. I love it. I love being able to input into a life and be part of building a life. That's just been an amazing experience for me, and working with families too has been amazing. So how did I end up getting in this place? A little over a year ago, somebody from the Republican Party came to my door and asked me if I'd consider running for office. And the first thing that ran through my mind was, are you crazy? But then, I didn't say that to him. I said, I will think about it and I'll pray about it, and I will let you know at the end of the summer. And that's what I did. I also talked to people who know me well, and I consider wise counselors, and they were all very encouraging and said, you'd make a good representative. So by the end of the summer, I decided I would do this, and I'm excited about it. I'm doing it mostly for my over 750 kids that I have, some in their 30s now. And those kids will also end up in long-term care someday, and it's important. It's important. So I'm here to represent them and all those like them, and our elders and everybody else. So I've had an opportunity through my campaign to talk to lots of people, and that's what I'm enjoying most about this. I love learning about things. What are the issues? What does the person think the solutions are? And I've talked to many people, from farmers to business owners to people working in nursing homes. I've talked to a couple of nursing home directors, Katie being one of them. I'm not sure where Katie's sitting, but I appreciate the time that they took. There she is. Katie and others to educate me about long-term care. I've talked to employees of nursing homes and other care places, and also the clients, the residents. And I love it here at Good Sam, I tell Katie this, that you call the people our elders. because I think that's a respectful term. And you know, I love Native American history, and the Native Americans revered their elders. They were wise people, and our elders are wise people, and I love being able to sit down and talk with them. But as I've learned from talking to all these people, we have a very critical problem with our long-term care. It's in nursing homes, it's in assisted care, it's in all of the areas. And the number one issue I'm hearing is staffing. I know St. John's has 10 openings right now that they can't fill. And Good Sam has 8 or 9 openings that aren't filled. And that's a critical need. And we have to look at education, and we have to look at pay for those employees, because the competition's great. The hospitals pay more, the other things pay more, and it's hard to keep employees and to get employees. And I applaud the people who are working here, because I know you're making a sacrifice by working here in the area of pay. But I know from my heart as a teacher, it's not the pay we're doing it for, is it? But it would be nice to have more pay, so that is a good goal. The other thing besides staffing is the funding, and that's where all the pay comes from. And we have, if I remember right here now, for the average client coming into a nursing home, Medicaid underfunds that daily amount by $34.44 per person. That might not sound like a lot of money, but if you have 90 residents and you multiply that times 30 days for the month, our nursing homes are going in the hole over $90,000 a month. And it's no wonder that we have nursing homes closing in different areas, nursing homes in financial difficulty, nursing homes that have to have fundraisers or borrow money to make ends meet, and that's not right. We have to find real solutions. I feel bad for our elders who are living in outer communities where their nursing homes are closing and they can't stay close to their family. That's not right. So we need to find a solution. I just kind of went blank on what I was going to say here, but I believe the biggest thing we need to do is prioritize our money as a state and stop spending money on things like light rail in the Twin Cities, which is an ongoing, hugely expensive thing, or a $90 million Senate building, or a ski resort in northern Minnesota. Those are all nice things, but we need to prioritize and put our money to where it really needs to go. Caring for our elders and making sure they have good, quality care. So I'll fill in more too as time goes, but I appreciate everybody who's here, and it's going to be a joy just to be able to talk together. You can strangle me now.
So the Minnesota legislature plays a significant role in setting funding levels for senior care providers. And prior to the 2013 legislative session, nursing home rates were frozen and housing providers received double-digit cuts. The 2013 and 2014 legislature did provide some additional funding for wages and benefits. So my question for you is, what will you do to support increases for senior care settings such as nursing homes and housing with services settings to help support wages and benefits of caregivers and to support quality care in our seniors? And maybe I'll start off with Shannon.
Okay. Thank you for that question. Yes, we did raise salaries by 5%, which we were giving to the nursing homes. But I know that's not enough, because these are people that take care of our loved ones, and more has to be done. The basic thing is we have to find a way to pay for long-term care that takes care of long-term care. And I don't know what that is, but we're going to have some hearings on that once the legislature starts again. What I was going to say about, there's been some flyers out about me voting for that $90 million building. That was settled before I even got to the legislature, and I did not vote for it. So I just wanted to make that clear. And so we need to find a way to fund long-term care, and that's a real problem, but there's other things that right now if you have an IRA, which is an individual retirement plan, the state considers that an asset. And you have to pay down on all of your assets, so you only have $3,000 left before you can get medical assistance. Well, if your spouse goes into the nursing home and you have to pay down your individual retirement plan and leave you $3,000, they say that you can keep your house and one car, but if you have only $3,000 in cash, you can't afford your house. So if you sell that, then the money goes to the nursing home because then it becomes an asset. That's not right. And the federal government, we're not in compliance, the state is not in compliance with the federal government. The federal government says you cannot impoverish the community spouse. And the 4 states have had lawsuits about this, and the judges have ruled with the complainant, so they've had to change their laws. I did have a law through last year put through that you could change your IRA into an annuity. It passed through all the committees, but it got stopped at the last part because it was too great a cost and would take too much money away from nursing homes. So the real problem is, how are we going to fund the nursing homes so that they can basically support themselves, pay good wages, and move forward? And right now, we're not doing that, and that's a very basic problem. And like I said, I have had experience with that in my own case. I have an IRA, but my husband and I owned a condo in Clear Lake that was paid for, and I sold that, and that's what paid for his nursing home once the 100 days was over that Medicare pays. Now, he couldn't get long-term care insurance because he had a muscle deteriorating disease and he had it before long-term care was even an idea. So there are a lot of people that can't afford long-term care, and the state is moving towards, Human Services is moving towards making sure that people can keep the spouse in their home longer, but I don't think that that is a viable solution. My husband was 6'1" and 210 pounds, and I couldn't lift him or help him do anything because he was just too big and too heavy. So I've had experience in this area. I know it needs to be done, and I'm working hard to try to find an alternative funding for long-term care, and I think we have to do that because in 2030, 1 in 5 of us will be seniors, and if we don't do something about it, it's going to break the state.
I think long-term care, what we've been doing for it thus far as a legislature, is just a Band-Aid. And that's what I found as I'm talking to our nursing home directors and employees, is all these things are little Band-Aids that get, trying to fix the wound that's underneath that's much huger than that Band-Aid is. So we need to find, like Shannon was saying, long-term solutions. But when we're throwing money, and for example, a year ago, nursing homes were given the 5% raise or whatever it was for pay, it really ended up being about 16 cents an hour for each employee in a raise. That's not a raise. So we've got to find those solutions. And I believe a lot of the solutions are there. And I'll tell you something I've learned as a first grade teacher. We teach our kids in first grade the difference between needs and wants. It's very interesting to hear what first graders think are needs, like a Nintendo game or something like that. But I think we need to bring that lesson up, and I would like to bring my first grade lesson up at the state level and help us prioritize what is a need and what is a want. We spend tons of money. We spent $2.1 billion extra this year in money, and a little drop went to our long-term care providers. That's got to change. Priorities need to change. So I'll state some of the things again, and I'm glad to hear you didn't vote for the $90 million Senate building, but that's one example of, if we have our nursing homes going in debt $90,000 a month, we should not be building a new $90 million Senate building. That money should come down to nursing homes. If we put money into, I'll say, light rail again, that's a Twin Cities thing, and light rail might be good for them, but from what I understand, not a lot of people ride it. But it's not just the cost of building, it's the cost of maintaining it. Those tickets are subsidized every year. The maintaining the trains happens every year, and so it's a long-term cost that we just can't afford. It's a want, not a need. Or the ski chalet that was built up north. Again, that's a want, not a need. I believe in my first grade classroom and even in my own home, we have to deal with our needs first. Long-term care is a need. So I'd like to start out by prioritizing money right away and getting it down to where it needs to be. And that would be right now for our elders in our communities and our employees of nursing homes.
I would like to say the rail system in metro area, that's being paid for by a sales tax to people in the metro area, and they voted on that and they wanted it, and it's not state money.
Can I say something back? I'll just say that. I actually looked it up last night and it's a mixture of Twin Cities money, but it's also some state monies going to that and federal money. So it's a mixture of all three. And so I say take the state money that's going to it.
Also, money went for roads in greater Minnesota, and about the same amount that the state put into the money in the light rail. The light rail is needed. There's I've been living up in St. Paul. There's all kinds of traffic jams getting to work, and the light rail basically eliminates some of that, and it is being used. So, you know, it's awfully easy to sit here and complain and not understand another area's needs, but they needed the light rail, and they're paying for most of it themselves through taxing themselves, which they voted on.
So workforce, especially amongst long-term care facilities in outstate Minnesota, is really a big issue. For example, my grandmother's nursing home actually closed within the past month because they didn't have enough workers to take care of her and the residents in the building. And so for my family, it was a scramble trying to find her a new place that was close to home because both of her kids still live in that area. So for the question for you two is what do you see, or what would you do as a strategy to help workforce development in long-term care? And I'll start with Peggy.
Thank you. Well, I think there's two big areas to look at in this shortage of workers. One would be what we've already spoken about, is the pay. Right now, nursing homes cannot compete with hospitals and other areas that have the licensed people and the various jobs needed. So we've got to somehow get that pay up to where it's more competitive. So that would be one thing. The second thing is we need to look at our education program. That's a field that I've been involved in on the lower end for many, many years, first grade and the primary grades. I just went to a higher education forum a number of weeks ago where there were, you know, the Riverland director and other people involved in higher education were there. And it was interesting to hear them talk about what we're educating our students for right now and what jobs are really out there for them. And that's something that we have to revamp as a school system in the, you know, kind of the 8th grade and up area. Start looking at what are we really preparing our students for. I believe only when kids go to college, only 60% of them graduate from college, is what they said at that forum. So we're not every kid is college driven or going to go to college, so we need to work on the trades, we need to work on the services and things like that. And that's going to be a different kind of education. So we need to start lining up our higher education then with what are the needs in our communities and start directing students and whatever their interests are. We want to lead them that way, but certainly our nursing type degrees and that assisted care places have and nursing homes have is something we need to direct kids into and work with our higher education areas. So education and then pay, I believe, would be the two things that would help that.
Thank you. Yes, we need to pay the workers more. After all, they're taking care of our loved ones. And most of the service people that I've seen working with the elderly are very dedicated and love their jobs. So we need to pay them a living wage. And that's what we're trying to do. We had a start on it last year when we increased the wages by 5%. We do have priorities with money, and one of the priorities the last couple of years was education. We paid back the shift, the money that the Republicans borrowed from education, we paid that back. We also increased the pre-student, what they get per student. We increased Albert Lee here by $954 per student. There is a disconnect between what education has been teaching our young people and what the industries needs. We have set up some trial programs, some internships in doing that, and we're working with community colleges and universities so that they can better understand the needs of industry and counsel our children towards one of the other jobs that they want. So we need to do that. We're competing globally now for jobs, and globally for people working. And so technology is a big part of that. So when you go from a college, you need a technical background, or even a community college, because even manufacturing jobs now are technical jobs. Used to be manufacturing jobs, people put the gadgets together by hand, but now robots put things together, and the person with the high-paying job is the person that maintains the robots or basically programs them. So yes, we need to change education, and we're working at the goal of our education committee is to have the best workforce in the world right here in Minnesota. But that requires that we invest in education. We froze tuition for universities and community college this last year. Our goals for next year is to help students that graduate with $30,000 debt or $40,000 debt pay off that debt by allowing them to refinance the loans at a lower rate, and also by some forgiveness of the loans if they take a vital job in greater Minnesota, and that's a goal. We're not going to solve everything overnight. We made some great steps forward this last 2 years, and I believe we're going in the right direction.
So Minnesota is growing older, and we are not prepared. By the year 2020, Minnesota will have more seniors than school children. 4 out of 5 people over the age of 65 will need some form of senior care, with an average cost of $48,000 per year. Still, 52% of Minnesotans have no plan to pay for their senior care needs, and only 10% of Minnesotans have long-term care insurance. If we do nothing to help Minnesotans plan and pay for their own long-term care needs, the demand for Medicaid could increase from $1.5 billion to $5 billion by the year 2050. So the question for you two is, what ideas do you have for empowering consumers and giving them information they need to plan and make prudent choices regarding long-term care?
Well, one of the problems with long-term care is a lot of people just can't afford the insurance. They're having a hard enough time paying for health care insurance, so they can't afford their own long-term care. In my husband's case, he had a muscle deteriorating disease before long-term care even became an option, so he couldn't get in on the insurance. We have to figure out a way, and I think we need a one-payer system, something like Medicare, where we take money out of a person's salary the minute they start working, and it would only be like 0.5%, and apply that, and then eventually when you have to go into long-term care, it would automatically be paid for. Germany does that. A lot of the Norway does that. Hawaii has passed a bill to do that. And basically, there's a lot of successes that we can learn from in setting forth our system. But it's going to take a while to do that. I mean, I plan to have a bill this session that will start the discussion on how we pay for long-term care. I do not expect it to pass the first year. Bills of that nature generally don't. But if we start the discussion and we let people put their input into it, within 2 or 3 years we could probably get something passed, because it is a major problem, not only in Minnesota, but in every state in the union. The cost of long-term care is skyrocketing, and we need to find a way to pay for it and to help people pay for it.
It's definitely a need, and those statistics show that. It concerns me when we talk about adding another tax, and we may have to, I don't know. But here's what concerns me. When we look at our Social Security, when we look at our Medicare and all the things that we're already being taxed for, those government programs are going broke. So we better make darn sure that whatever we do is a good program and a wise program, and it's not on the road to going broke like these are, because it concerns me greatly that our seniors who are depending on Social Security and depending on Medicare, it might not be there for them. Might not be there for me when I get to that age. And we need to make sure that these things are funded well. So when I hear just doing another tax, that kind of, it does concern me, because it just means another big government program to me, and I don't see that big government handles it that well. I don't know a lot about this area, so I don't like to speak to things I don't know about without doing research, but I would say one thing we could possibly model it after is doing some incentivizing, that when a baby's born, they start out with some kind of a long-term care savings account like some families do for education, and that might be a way to do it. I would much rather see it closer to home, more privatized if possible, because the minute it goes into the big government system, a huge amount of money never gets to the people who need it. And typically those programs are on the road to going broke, and then another 50 years from now we're going to have to fix that program too. So I won't speak to it much because I don't have a lot of knowledge in that area yet. So.
Next question. So the demand for senior care services has shifted from traditional nursing homes services to more assisted living options, as well as home care. In fact, the average length of stay at a nursing home is 28 days. So what will you do to ensure that older adults should live independently for as long as possible in their homes?
I think one thing is we have to do some more preventive care as far as the insurance is concerned, so people stay healthy longer. But the other thing is we need to have help for them in their homes, like people come in and actually help them. My husband had that for a while. But that only solves so many problems, and you only decrease the care a little bit with that, because there comes a point when you can no longer take care of a person in your home. And it was very hard for me when I had to put my husband in a nursing home. He had been in a wheelchair for a number of years, and the last week he was home, he fell 3 times. And I had to call the ambulance all 3 times to put him back in his chair because I could not pick him up. And when it gets that bad, that they have to be lifted and carried and dressed and showered and do everything for them, they absolutely need to go into a nursing home or someplace where they're taken care of. And I want nursing homes to stay around because they're very valuable and they help the elderly. Now, I think that we need to be realistic about how you pay for this. My feeling is, parents were told to put money aside for their children's education. If you're making just the cost of living and you're having a hard time even feeding your children, you're not putting money away for their education. Or if you're having a hard time feeding yourself, paying rent and all of this, you're not putting money away for your long-term care. So it would be nice if everybody could, but I think that's a dream. So.
Can you read that again, because I kind of lost it. Sorry.
Sure. So again, the question is, what would you do to ensure that older adults could live independently for as long as possible, say in a home or assisted living?
Okay. I know there's a type of funding called elderly waiver. I'm just learning about that. But that is one area where I'm understanding that there's some people that could be in an assisted living home that have to go into a more expensive bed or room or whatever the word would be for nursing home because there's not enough of this elderly waiver money. And so I think we need to make sure that the people who want and are able to live in those assisted living care, that we allow that somehow, and it has to do with the government paying of things, and I'm not totally understanding that yet, but that's one area. We have a lot of private, or some anyway, private assisted living homes, and to me that's another way of allowing our seniors, our elders to live in a situation where it's more home-like and so on. So I think we need to make sure that we're also allowing them to operate well, and so there's different ways to look at that, but we need to make sure that people can, as long as they are able, live in the assisted living versus going directly to a nursing home.
So this will be my last question for them, and then we'll open it up for the audience to ask questions, because I'd like to also leave a little bit of time for them to do some closing statements, if that's okay. So the last question is that senior care providers face significant regulations, both from the federal and state agencies. So do you have any suggestions for regulatory reform in the senior care sector?
Well, I'm a little bit out of the loop as to what regulations are currently on nursing homes, but if it's anything like education and the unfunded mandates that we get at school, then I can totally understand that, because we have many mandates that we have to do things certain ways or test kids certain ways, and it costs a lot of money and it's not funded. So my thought is you would get together our long-term care people, nursing home directors, some employees, some seniors, and city people and so on, and get together and figure out which of these mandates can we get rid of, which are not needed. You know, we all want to take good care of our elders, and we don't necessarily need a million mandates to do that. So I would have to learn more about what kind of mandates are currently on, the homes, and then talk to those people and say which ones are unfunded, which ones aren't necessary, and kind of go from there.
I believe that regulations aren't bad. It's how you implement them that is bad. And so we may need to make sure that the people that implement them are properly trained. You can go into a nursing home as an inspector and say, I'm going to find something wrong here. Or you can go into a nursing home as an inspector and say, I'm going to look for the good things that they're doing and reward them for that. And I think that's the way all inspectors should work, whether it's in a manufacturing facility, a restaurant, or a nursing home. And I think that the regulations can be simplified. We did some of that this last year. We looked at every statute in the book, and we eliminated a lot of the statutes that no longer pertained. One I laugh about, and was still in the books, is that you had to notify somebody by telegraph if it happened. So, nobody was following that anymore. But there were a lot of regulations that could be taken out and were taken out, and that's just the beginning of reducing the cost of government. And again, I don't think regulations are bad. It's how you implement them, and you need to have a flow chart, and you need to do it in the right way. I worked with manufacturing, and they have a lot of regulations, but most of the regulations were good for the consumer. And I think regulations are not bad, just you need to work with the people that are implementing it and their goals. Because some of the groups, they evaluate the regulators by saying how many bad things they find. But if they turn around and say how many good things did you find there and how many things did you appreciate in the building, then basically they become better regulators.
All right, so I will open it up to the audience, and you may have to, I will try to bring a microphone to you, or you may need to come up here. I don't know what the best way to do it is. Okay, they can just come up to the podium if you want. So, question?
I think, should I try and see if they hear me? Can you all hear me? Shannon, you mentioned preventive care will possibly help with some of these. Do you think our current healthcare system in Minnesota is going to help with this? And I'm not thinking just of those who are elders now, but some of these younger people in the room. When you're talking preventive care, do you think that our type of health care insurance, whether you want to call it Obamacare or Affordable Care, is going to be the answer?
I think Minnesota care needs to be improved. But right now, 40% of the people that were uninsured before are now insured, and it's already bringing down rates in certain areas. And we're going to have much more options in this district than we had a year ago. It needs a lot of work. It needs a better computer system or systems, but it's beginning to work. Now, preventive care, Medicare already has that. I have Medicare, and a few years ago, you couldn't get paid for preventive care, but now they've added more preventative care in Medicare. It's one of the ways of saving money if you take good care of yourself. I think another way is you need to tell people or advertise for people that they need to exercise and they need to keep their weight down. And like everything else, they're probably not going to listen, but eventually it'll probably get through to a few of them. And I think preventive care is one option to reduce the cost of long-term care, but it's not the only option because there are certain people that will never take care of themselves. But the insurance systems are now starting to understand that if they have preventive care in their policies, that it reduces their long-term care. I don't mean it that way, the care that they're going to pay, the money that they're going to pay out over the long term. It's just one aspect of the whole solution.
Sure, thanks. I'll just speak to that briefly too. If I was to answer that, I would say no. I don't think our current healthcare system will address that. Number one, in order to get people to really start taking care of themselves, we need a more patient-centered type of healthcare. And right now, we're insurance-centered. We need the type of system where it's between the patient and his or her doctor more, and that's the driving factor in health insurance. Also, as far as affordability, it might be affordable in the Twin Cities, but in our area in southern Minnesota, it is absolutely not affordable. Our healthcare premiums cost $1,000 or more a month for the very same plan that they have in the Twin Cities. I don't think that's affordable healthcare. The other thing is, in Minnesota, we had a program before where like 90% of the people were already covered with insurance. And we've upped it a couple percent, but how many people have we hurt with that, with the incredible premiums? I've talked to so many people. A semi-retired veterinarian, his costs went up $750 a month, and his premium, or his that was his premium for the month. A friend of mine who works at a grain elevator, last year his insurance went up $500 a month, and now this year it went up another $750 a month. So we've got a lot to deal with MNsure/Obamacare, and some of it's out of our control because it's being directed federally. But definitely we need to look at a patient-centered one. I think of just the cost, let's say, for a prescription. Now that I have to pay for some of my own prescriptions versus before I never saw the bill, it makes me think more how I'm going to spend. And that's the type of system we need, where we get people to think of, you know what, I need to walk every day because then I won't be spending so much money on my doctor bills, or I need to do this, or shop prices. So there's a lot of different things that we need to do, but it's a big fix.
Any other questions?
I don't have a question, but I have a comment.
I can move up if I need to. Okay. One of the things that I'm thinking about is, and a lot of people, don't shoot the messenger. We provide in this country, when I was a social worker, I had all of the old age homes in the entire county, so I saw this repetitively. I believe that the first 21 days, the government picks up. I think that's one major way to get some money back where it belongs. I think that should be eliminated. And I know we don't like to hear that. I'm trying to think. I wished I had a notepad so I could write my stuff down. And a second important part with education, I think there's too many people that rattle around and think, oh, when I get old, somebody will take care of me. Well, the somebody is you and I, and we can't afford that. I think starting in the very, very elementary grades, kids should be taught a new mindset that when they get older, it's going to be very expensive, and they need to start either saving or thinking about that, because we can't allow them to continue to think somebody's going to take care of them. And that would save some amounts of money if they begin to change their behavior.
Did you want to comment on that?
I will, yeah.
I appreciate your comment very much, and I agree with you. We need to start having a new mindset where the answer is not always the government. The answer is us as a community, and government has its place, but right now, you're right, we have a mentality that we're teaching our young people that, don't worry, the government will take care of you. You know what, the government might not always be there either. We don't know. We need to be prepared as a community, as individuals, to have that mindset that, no, my community will take care of me, or I'll start saving right now so that, and I know some people don't have the money, but that's something always to work on, and the whole mindset is something that we need to start getting people to think that direction. And so thank you for your comment.
Sure.
Before people can start taking care of themselves, we have to give them a livable wage so that they can earn enough money to take care of themselves and their family. And I'm with you on that. We need to start taking ourselves, but there's a lot of things that are standing in our way right now. And one of them is low wages, and we need to give people a livable wage, basically, so that they can take care of themselves.
All right, I thought of another question back here.
I can just speak up.
Okay.
Representative Savick, thank you very much for your service. I appreciate anyone that steps out into the public arena to help us. I have a two-part question. I hear a lot that Republicans were the ones that robbed education or shifted money education. Does that mean that only Republicans voted? Did that fall right on party lines? And then I hear the Democrats taking credit for paying it back. Did that also only fall on party lines? So Republicans took it and Democrats paid it back. Is that the way that worked?
I wasn't in the legislature when the shift was, so I don't know, but it was the Republicans that were in power at that time, and based on my 2 years in the legislature, I know that on things like that, people vote down party lines. But I will tell you, in paying it back and doing the budget for this year and last year, it was party lines. Republicans voted against it and the Democrats voted for it.
Okay. My second question is this. You being an outstate legislator, it seems like in Minnesota, and I've been watching this in the gubernatorial debates, that we really, in essence, have two states. We have outstate Minnesota, and then we have the metro area. And I thought I heard you say that you do support the light rail, but that you did not have the opportunity to vote on the Senate building. I see those two things as hurting outstate Minnesota. I was the chaplain at this particular facility for 2 years, several years ago, and our administrators, our nurses, housekeeping, our CNAs, LPNs, they're some of the hardest working, most dedicated people that I've ever observed in my lifetime. But the Senate building, $90 million, and the light rail, I see those things as hurting outstate Minnesota, especially in this type of facility. How would you have voted if you would have had the opportunity to vote on the $90 million Senate building?
Let me tell you the story of the $90 million Senate building. The Capitol is crumbling. So about 4 years ago, they voted to spend $100 million fixing the Capitol. We didn't want it to fall down. Once they got into it, when the Capitol was built 100 years ago, it met the needs of the population at that time. But at this time, they only got, I don't know how many visitors a year, but we're getting about 60,000 visitors a year. So we needed more conference rooms. We needed more bathrooms. The governor's space, he has some of the offices in the mansion because he doesn't have room in the Capitol building. So what happened is they put in more bathrooms, more meeting rooms for the constituents, and the governor was given more space. They kicked the Senate out of the Capitol. Okay, they have no place to go. They looked at the Macy's building downtown, and they got a bid on how much it would cost to remodel that. It was almost the same amount of money as building a building. There was another building in the area that had been vacant for 15 years. They looked at that to remodel that, and a building that's been sitting vacant for 15 years has a lot of problems in it. Mold is one of them. And so the least expensive solution was building a new building for the Senate. Now, it's not a $90 million building, it's a $70 million building. I don't think that makes much difference. Part of that money goes to a parking ramp that will pay for itself. They didn't spend all the money at once. They have a mortgage on that, a low-interest mortgage, and it'll be spent over the years. And the trouble with the Macy's building was that's downtown St. Paul. They would have had to have communication, transit from the building to the Capitol in order to get the senators up there to vote on things. So it wasn't really very logical to have that. Now, I didn't get the opportunity to vote on that, and I don't know how I would have voted, but to me, remodeling the Capitol building was way past the due time. And you had another question, and I forgot what that was.
That was my question.
Okay.
How would you have voted?
Okay, well, I didn't have to vote on it, so I don't know at this time. I've never sat down and said I would either vote for it or wouldn't vote for it. But we do need a Senate building, and that was the history of it. So it's not money spent that we didn't need. It's money spent that we did need because the Senate had no place to go once they remodeled the Capitol building.
House Bill 677, that was the Senate design bill vote, and you voted yes, is that correct?
No, we didn't vote on anything that came in on that. The design went to the Rules Committee in the legislature, and the Rules Committee decided that they wouldn't take it to the floor, and I don't know how they worked it, but they okayed basically the bill for the building. But they also cut a lot of things out of it because that was a $90 million building, and the building no longer has a swimming pool and some of the other things that the Senate sent down. But it was the Rules Committee that approved that, and it never came to the floor.
I would like to speak to the question you had about the school shift. And I did look into that bill when it was voted on. It was a bipartisan vote. So it wasn't just the Republicans that decided to shift that money out. It was a bipartisan vote. And also planned in that bill was, and I don't quote me on this part because I'm thinking I remember it right, was the payback that would happen. And so I do have a little problem when you blame it all on the Republicans because that was a joint decision at a time when there was a need. I honestly don't think money should be taken from the schools. So that's, if you promise the money to the schools, then that should be theirs. Otherwise it goes on the backs of the local schools where they have to borrow money. Yeah.
Can you comment on the closing of the daycare in St. John's? There's regulations or something that cause some issues?
Yeah, and that was sad. I know in talking to Katie, I've always thought it was a wonderful thing to have a daycare in this place, and what better thing to do to put grandparents with little kids, and good for both groups. But there again is where over-regulation comes in. There was a regulation that St. John's had to have a particular certified employee that was going to cost too much money. It was a change in regulations. And so I would have to say, Shannon, I do believe there's bad regulation. I don't think it's all just a matter of how you do it. We have common sense regulations that need to be here. And there's always got to be a balance, but we've gone overbalance in regulation. And that over-regulation needs to go because it's affecting nursing homes, it's affecting daycares. Daycares have to close. Nursing homes lose money. It affects business. It affects farmers. One feedlot, 4 inches of paperwork. That's not just trees that it kills, that's money, and money is time for a business. So overregulation is a huge problem. I think it's probably our #1 problem in all areas, aside from the funding problem of the long-term care business. But that's got to be dealt with. And I think it's incredibly sad that those little kids are no longer going to have the elders that could come and visit them around anymore. And for the elders, what a lovely thing to have little kids around and bring some life into the day. So let's get rid of some of this over-regulation.
Any other questions?
I would like to know how much the average salary or pay is here at the nursing home, and how much are those administrators making? You know, 80,000, maybe they can give a little bit more to the lower echelon. Why is it so expensive? 6, 7, it goes from $1,100 a month to $11,000. And why are they allowing St. John to build a new home out there?
Hi, Katie Davis, I'm the administrator here. I'd be happy to answer that. We actually in Minnesota have what's called a rate equalization. A rate equalization, meaning we have no, let me get out to the side here. We, myself, other administrators in Minnesota have no control over how much we charge for a nursing home resident to come into this building. So, and typically if somebody comes in, we do some assessments, put them into a computer program, and really it generates what the rate per day is going to be for a nursing home resident. Minnesota and North Dakota are one of two states that our government tells us how much we can charge for a nursing home resident. So I have no control as an administrator how much I can charge for a resident coming into this building. So that's really an excellent question, and that is why we rely on our legislators to help advocate for nursing home residents, to help advocate to increase our rates so that we can pay our employees the wages they deserve.
How much is that?
How much is what?
The wage, the salary. They start out and then they move up, I suppose.
Great.
What's your salary?
Yeah, I'm not going to share that with you right now, but we do have starting salaries for CNAs, nurses, LPNs that we go on a wage grid. So really a new employee coming into our building, we look at their past education, their experience, and all that is put into a wage grid. But again, we rely on the income from our residents. And those rates that are set by our government, we rely on these individuals to help be advocating for us. Does that answer your question? Thank you.
How much is it? $11 an hour to 15 or 20?
Sure. For a starting CNA or? Yep.
Just for a person who comes in with high school education.
Okay. Depending on what center, the starting CNA could range anywhere from $9 to $11. Nurses anywhere from.
Plus benefits?
That depends on, some centers offer benefits, some centers don't offer benefits. I can't speak to other centers. And with St. John's building, I also can't speak to the building of St. John's.
Speak to your building.
No, meaning.
Do you have health insurance for them? Do you have vacation?
Yep. We do offer benefits. Yep, we have employees have the option of either having benefits or not having benefits. Yes. And I'd be more than happy to visit with you if you have other questions at the end. I don't think that's pertinent to this discussion, so thank you. Sure. Yeah.
You know, I don't know that that's the key as to what these people are making. The key is nursing homes are in between a rock and a hard place. Their rates are set. Their funding mostly comes from Medicaid. They're underfunded that way. And it's not so much what they're making. Harold, is that right?
Yeah, that's right.
Harold, okay, Harold. They have to be competitive in the market. If our hospitals are paying the same licensure of employee twice as much, can we even find somebody to work here? That's the problem. It's not the pay, they're being paid too much, they're being paid too little. It's the competitive nature of it. So we have got to, that's why it's got to come up. And you're shaking your head no, but okay, then they'll have to close. Well, it does make sense because it's called the competitive market. And if you are paying a nurse, I don't even know what nurses make now, but if you're paying that nurse this much money, and at a nursing home they can pay this much money, where are those nurses going to go? Right there. So that's the problem, and it's a huge staffing thing. So now what are we doing? I had a person at Canuson Place, I was speaking there not long ago. One of the residents said, why are nursing homes closing? This is why they're closing. We can't staff them, and we can't fund them adequately. They're losing money, and they can't get anybody to work for them, except for the lovely hearts that care so much that they'll do that. So that's the problem.
They just built a new nursing home in Montana, and there's 99% of them have a single room. You know, one person in a room. Why not have two like you did in the old days?
So,
It's a question.
Okay. So, what I think we'll do is we give some time for questions, and I think I will hand it back. I actually have one more question. Oh, yeah, sure. Katie can answer the question.
Okay. I've spoken to both of you about kind of being our voice at the Capitol for our employees, for our elders, for our family. You two are, we need a voice, and we need you to be advocates for all of us. So I would just ask that maybe you share with our employees, we have elders in the room, we have family members in the room, of specifically how will you advocate for us, and how will you be our voice? Not all of us are able to go to the Capitol and visit with you every day. So we trust that you would make those decisions on our behalf. So if you could just speak directly, again, to employees and family members and our elders about how you will be our voice.
Is this kind of our closing remarks?
Yes.
Okay.
Thank you for asking that question. Okay. As I've said previously, I've had a lot of experience with nursing home because my husband was in one for about a year and a half. And I know that it takes a lot of dedication to take care of people that can't do anything for themselves. And it isn't, we need to have more money coming to nursing homes so that you can pay your help better, so that you can take better care of the patients. And I can respond to that because I've been there and I know the hard work that you do, and I know that you do need the additional funding to move forward. I am not on that committee, but when it comes to something like that, I can talk to people that are on that committee and basically advocate. Now, Patty Fritz, who is a friend of mine, is probably the best advocate that you have in the nursing home. And I talk to her all the time. She sits very close to me. And I take her advice on nursing homes because you can't know everything about everything that you have to do up there. But I will be a strong advocate, and I know what it means to have a loved one in a nursing home. And you worry about their care, and you basically you have to have faith in the nursing home that they're in, and they have to have the money to do the job. So basically, that's where I'm at with that. So.
My heart is for the people, and that's all of us. I've spent my whole adult life advocating for my students and their families. And anybody who knows me at Sibley School can know that I fight for them. And I will do the same for the people of this community because your needs are my needs. I believe in listening to the people, and I don't want to just listen to somebody else up at the Capitol tell me what the problems are. I want to talk to the source. And that's the people in my community, and the people who run nursing homes, the people who work in nursing homes, the people in our businesses, our farmers. And I will listen. And I will fight for this community, and not just long-term care needs, but every need. I'll fight for our seniors. Their life, they want to stay at home as long as they can. Let's just think of the ones that aren't in long-term care yet, and all the expenses that they have that are going up and are out of their control. I look at energy costs. Our government is saying, we'll give you a little energy assistance. Well, how is that helping when our energy companies are telling us that energy costs are going to go up 4% a year for the next 5 years because of the mandates that are on them right now, just to pay for those mandates? What does that do to the senior person who's living at home on a fixed income? Are they going to choose between heat and food? I don't know. But we need to look at all of these things. And like I said, my passion is for the people. I think of health insurance and the things that affect our seniors there. I don't know if a lot of our seniors know that part of the MNsure bill, and it's in the fine print, you aren't going to read it when you sign up for it, but those people are getting subsidized in the medical aid portion. It says in the fine print, and I've got it in my purse if you want to see it, that if you die 55 years or older, the state will come back and recoup the costs from your estate. So our seniors who want to leave money to their children maybe don't know that, and they need to know that. So I want to see people know the truth, and if I find it out, I'll tell you whether it's good for my party or bad for my party, because I'm representing this area. I'm representing a philosophy that says that we are being overregulated by our government, and it's affecting us tremendously in all areas. Let's go back to common sense regulation. We're being told to, my goodness, in New York, they're being told what size soft drink they need to buy, you know? I'm sorry, we have a brain, we can decide those things. So let's get back to some common sense balance in our government. And I would love to be your next representative. So thanks so much for coming here and your good questions and everything.